Here are the most common signs of colon cancer, also known as colorectal cancer. We'll be diving deep into 8 crucial warning signs of colon cancer that you absolutely shouldn't ignore, so stay tuned till the end. Remember, knowledge is power, and early detection can truly be life-saving. We'll break down each sign, discuss what to look out for, and emphasize when it's time to seek medical advice. I can't stress this enough. If you experience any of these symptoms, don't hesitate to reach out to your doctor. Our first red flag is a change in your bowel habits. This is something that can often be overlooked but is incredibly important to monitor. This is a big one, guys. It's not just a minor inconvenience, it can be a significant indicator of your overall health. If you're experiencing persistent constipation that just won't quit, or if you're dealing with diarrhea that's lingering longer than a few days, it's time to pay attention. These symptoms can be more than just a temporary issue. And it's not just about the frequency of your bowel movements. The texture and appearance of your stool can tell you a lot about what's going on inside your body. Keep an eye out for any changes in the consistency of your stool as well. Is it harder or softer than usual? These details matter. Are you noticing that your stool is consistently narrower than usual, almost pencil thin? This could be a sign of a blockage in your colon, which needs immediate medical attention. Don't ignore these signs. They are your body's way of telling you something is wrong. This can be particularly frustrating and concerning. These changes in bowel habits can be subtle, and they might not always mean something serious. However, they are worth noting and discussing with a healthcare provider. But if they persist for more than a couple of weeks, it's crucial to get checked out by a medical professional. Early detection and treatment can significantly improve outcomes. Don't brush these changes off as just something you ate or stress. Your body is trying to communicate with you, so listen to it. Early detection and treatment can significantly improve outcomes. Now, let's talk about another alarming sign. Blood in your stool. This can be a very distressing experience for anyone. This is a big red flag that should never be ignored. It's a signal from your body that something might be wrong. I know it can be scary, but trust me, it's crucial to address this immediately. Early detection can make a significant difference. Blood in your stool can manifest in different ways. It can appear in various forms and colors. You might notice bright red blood on the toilet paper after wiping, which is often the most noticeable sign, or you might see blood mixed with your stool, which can be more alarming. Sometimes the blood might not be visible to the naked eye and can only be detected through a lab test. This is why regular checkups are important. This is called occult blood. It's hidden and requires special tests to be identified. There are several potential causes of blood in stool, ranging from hemorrhoids, which are usually harmless and quite common, to more serious conditions like colon cancer, which requires immediate medical attention. That's why it's essential to get any rectal bleeding checked out by a doctor to determine the underlying cause. Early diagnosis can save lives. Don't delay seeking medical attention if you notice blood in your stool. Prompt action is crucial. The sooner you get diagnosed, the better the chances of successful treatment if a serious condition is detected. Your health is worth it. Moving on to our next warning sign, persistent abdominal discomfort. This can manifest in various ways, including cramps, gas, bloating, and pain that just won't go away. If you're experiencing frequent abdominal cramps that are severe or unusual for you, it's essential to pay attention. Similarly, if you're feeling bloated or gassy more often than not, and it's not related to your diet, it's worth getting checked out. And then there's persistent abdominal pain. This is different from the occasional stomachache we all get from time to time. We're talking about pain that lingers for days or even weeks, and it might come and go without a clear explanation. If you're experiencing any of these symptoms, it's important to keep a symptom diary. Note down when the discomfort started, how often it occurs, any patterns you notice, and if anything seems to trigger it or make it better. This information will be valuable for your doctor when you seek medical advice. Let's talk about a symptom that can be quite frustrating and uncomfortable, the feeling that your bowel doesn't empty completely. This sensation, known as tenesmus, can be a sign of something going on in your colon. Imagine this. You've just gone to the bathroom, but you still feel the urge to go, even though you know you've emptied your bowels. It's like your body is sending mixed signals, and it can be incredibly bothersome. This feeling of incomplete evacuation can be accompanied by straining during bowel movements, a sense of pressure in your rectum, or even pain. It's often caused by an obstruction or irritation in the rectum or lower colon. If you're experiencing this symptom regularly, it's important not to ignore it. While there are benign reasons for this feeling, it can also be a sign of a more serious underlying condition, such as colon cancer. Now, let's discuss a symptom that can be a bit tricky: weakness or fatigue. It's something many of us have experienced at one point or another. I know, we all feel tired sometimes, right? It's a common part of life, especially in our fast-paced world. But when it comes to colon cancer, persistent fatigue can be a red flag. This isn't just your everyday tiredness. We're not talking about the kind of tiredness you feel after a long day or a poor night's sleep. This is something more profound. This is a different kind of fatigue, the kind that lingers even after you've gotten enough rest. It doesn't go away with a good night's sleep or a relaxing weekend. It's a feeling of exhaustion that seeps into your bones and makes even simple tasks feel overwhelming. Everyday activities become a struggle. This type of fatigue can be caused by a number of factors, including anemia, which is a condition where your body doesn't have enough healthy red blood cells to carry oxygen to your tissues. This lack of oxygen can make you feel incredibly tired. Colon cancer can sometimes lead to anemia due to bleeding in the digestive tract. This internal bleeding can be slow and go unnoticed for a long time. So if you're experiencing persistent fatigue that's accompanied by other symptoms like pale skin, shortness of breath, dizziness, or cold hands and feet, it's essential to see your doctor. Early detection can make a significant difference in treatment outcomes. Now let's talk about another red flag that often goes unnoticed until it's more pronounced: unexplained weight loss. This means losing a significant amount of weight without making any conscious changes to your diet or exercise routine. If you're suddenly shedding pounds without trying, it's essential to pay attention. I'm not talking about losing a pound or two here and there. I'm talking about a significant and unintentional drop in your weight, like 5% or more of your body weight within a 6-month period. This type of weight loss can be a sign of various medical conditions, including colon cancer. When cancer is present, it can affect your body's metabolism and its ability to absorb nutrients properly, leading to weight loss. So if you're noticing that your clothes are fitting looser, you're losing weight without trying, or people are commenting on your weight loss, it's crucial to see your doctor to rule out any underlying medical conditions. Let's discuss 2 more symptoms that can be quite common and often attributed to other less serious conditions: nausea or vomiting. While these symptoms can be caused by a variety of factors, they can also be signs of colon cancer, especially if they're persistent or accompanied by other red flags. Nausea is that queasy, uneasy feeling in your stomach that makes you feel like you're about to vomit. It can be a temporary sensation that comes and goes, or it can be a persistent feeling that lingers throughout the day. Vomiting, on the other hand, is the involuntary expulsion of stomach contents through the mouth. It can be a one-time occurrence, or it can happen repeatedly. When it comes to colon cancer, nausea and vomiting can occur for a few reasons. If the tumor is large enough, it can partially or completely obstruct the bowel, leading to these symptoms. Additionally, cancer can release substances that disrupt the digestive process, causing nausea and vomiting. Let's talk about a condition that can be a sign of colon cancer, especially in older adults: iron deficiency anemia. Anemia occurs when your body doesn't have enough healthy red blood cells to carry oxygen to your tissues, and iron deficiency is one of the most common causes of anemia. Iron is essential for the production of hemoglobin, a protein in red blood cells that carries oxygen throughout the body. When you don't have enough iron, your body can't make enough hemoglobin, and you may develop iron deficiency anemia. Symptoms of iron deficiency anemia can be subtle at first, but as the condition progresses, you may experience fatigue, weakness, pale skin, shortness of breath, dizziness, headache, cold hands and feet, and brittle nails. In the case of colon cancer, iron deficiency anemia can develop due to chronic blood loss from the tumor in the colon. This blood loss may be slow and gradual, so you may not even notice it in your stool. We've covered a lot today, and I know it can feel overwhelming, but remember, knowledge is power. By being aware of these 8 warning signs, you're taking a proactive step towards protecting your health. Early detection is key when it comes to colon cancer. The earlier it's caught, the better the chances of successful treatment. So please, if you experience any of the symptoms we've discussed, don't hesitate to reach out to your doctor. Don't let fear or embarrassment hold you back. Your health is your most valuable asset. Get screened, stay informed, and take charge of your well-being.